There is no other way to handle your body,
Yeah.
your skin, if you're not starting from the gut. But only thing that face wash is doing is taking away the hydration.
It's projected in such a way that after using this product, you'll start looking like this.
Yes.
And then that is something that gets people to buy all the skincare and hair care products that you're seeing today in the market, and you don't know
Agreed.
what it's doing to your skin.
Everyone would do well by using a vitamin C serum in the morning.
Okay.
Bring our focus back to saying that anything which needs to be used daily better be the safest thing that you're
Absolutely.
using. Right? I mean, I'm just wondering if somebody has cardiac ailment, are they going to go and apply a cream on it just because Instagram said so?
Yeah.
I mean, the skin is as important an organ as your heart, as your
Yeah.
lung, as your
Yeah.
liver. What do you need to do before you get into laser hair reduction? A.
Hey everyone, welcome to another episode of That Healing Feeling with me, Neha Ranglani. And today I have on my episode Dr. Falguni Shah, who is a Mumbai based celebrity cosmetologist and dermatologist and is the founder of Radiant Skin Clinic. She specializes in non surgical facial rejuvenation and anti aging solutions, combining advanced science with aesthetic expertise. With specialized training in lasers and cosmetic procedures, Dr. Shah is redefining skincare with precision and innovation. Join me in welcoming Dr. Falguni Shah. Thank you so much, Falguni, for being here. And I'm so glad that you are here with me today because this is one topic that I really wanted to cover in my podcast. There's so much that goes on in the skin industry. Every day you're hearing about new things, new trends that are coming up, and people are falling for it, right? Because it's instant gratification. You want to look good, you want to feel good. Everything is how you look externally, and people are spending like lot of money today on skin treatments. So I'm glad that you're here today because I'm going to ask you a lot of questions to debunk a lot of myths and to tell us the truth about the dermat industry.
Yeah, I am completely geared up because I think one of the things that, as someone who's been educated on skin, which is the largest organ of the body, is to also spread an awareness about respecting that organ rather than just misusing that organ and making it just an outer layer or a wrapping paper for a box. So I'm very excited for this and let's get on with it.
Yeah. So tell me, as a dermat, the first question I want to ask you is, what is the kind of pressure you have to deal with? Because everybody wants instant results. When they come to you, they are expecting to come out maybe few shades lighter, acne marks disappeared, and very absolutely unreasonable expectations.
Right.
How do you deal with that pressure?
So initially I used to get really harrowed by it, and I would have like, oh, of course this can't be done, and all those things. And then I realized that what is important is to align expectations. So when somebody comes and they feel that I have a certain amount of money, and depending upon what amount of money they have, they think they can achieve that amount of good looks. So for example, somebody comes with a lot of money, then they feel that I can look as good as ready to start and participate in Miss World. And someone has lesser amount of money, they would say that I can look as the best looking girl in my colony. Now what contributes to this is a whole lot of misinformation which is meted out, sorry to say, via Instagram. Earlier I used to say that my biggest enemy was Google because people used to read on Google and come, but Google had some facts and some science. Instagram, you're legally not questionable. Nobody can question you on what you're saying because it's what I feel. There is no science to back it, and people and influencers are out there talking about skin, about skincare, and also about treatments. And they don't even have to be science educated, forget being a doctor. So that kind of misinformation what people come with. Now my consultations have taken a different route. I spend more time telling them what not to do, and then I begin with what to do.
So basically, unlearn and relearn.
Unlearn and relearn.
Because they're learning all the, very absurd and obnoxious things on social media. And I quite resonate with what you said, because as a nutritionist, I see a lot of people talking about diet and health and disease reversals without having any foundation in the field or any knowledge or any, proper education about it. And they are out there because they have a platform, and then the platform is giving a voice to everyone, and that is then creating so much problem because then people like us who've really invested so many years in formal education and learning and understanding and experience, we have that experience, we have to prove that why that is not right and why what we are talking is right, because that is instant gratification. What these guys are putting out is instant gratification, and what we are talking about is long-term sustainable health.
Like, I mean, just taking a cue from this, like because I like fitness and I work out, I see people in my gym who will do certain exercises from the YouTube. And I will see them healing their whatever joint pains or whatever injuries they have got from YouTube. And I've also seen people discussing diets on YouTube and following those diets at home without understanding that what you are following is a diet and not nutrition. So the nutrition has become equivalent to diet. So nutrition is a science word and diet is what I eat at home.
Diet is just a fad. I mean, every diet is a fad. And anyways, as a nutritionist and as a health coach, I find the word diet so cliched.
Absolutely.
Because I feel diet is so restrictive. But are you following a healthy plan? And is it planned for you? Is it tailored for you?
And where are you going towards? Are you looking into your short chain fatty acids? Are you looking into what is happening to the gut? But you know what I'm talking about.
And talking about the gut, I'm really very, very happy that you even mentioned that, because I don't see too many dermats do that.
There is no other way to handle your body,
your
skin, if you're not starting from the gut.
Great.
So the reason when we say that beauty is not just skin deep, what we mean by that is it comes from your gut.
Literally. Your acne stems from gut. Your pigmentation stems from your gut. Everything.
I would not say it stems from the gut, but I would say that all these things could get better by bettering the gut.
By what I mean, it stems from the gut is because if your gut is inflamed, your skin is going to be inflamed.
Absolutely.
So it stems from the gut.
Aging is inflammation. And the biggest way to take care of aging is to reduce that inflammation, which comes from the biomes.
So you basically also tell your clients to focus on overall nutrition and focus on holistic health and mind and body and gut and hormones.
And it is so difficult for me to tell them to not eat a particular thing, because if you say don't eat this, for example, I wouldn't want to say it right now, but if they will say, oh, seriously, are you mad? Like if I tell somebody don't use a hair oil, they will say, I'm not even coming to you. My grandmother used to use hair oil. So we have to, but scientifically, just, moving away from the subject, nobody in the world uses a hair oil other than Indians. Everybody has good hair. Do we need a hair oil? We used to when we didn't have a conditioner. Now do we need a hair oil? No. Should we use a hair oil? If you want to relax, you use it. Is it going to help you? No. Can it harm you? If you have a certain kind of scalp, yes, it can even harm you. So to break this long unscientific chatter which has happened in our society from eons and decades, it's a long journey. And I just hope that we can probably get on to the journey, beginning with this podcast, and take it forward.
We'll talk about hair. I would like to know more about the oil bit, probably in the hair section. But I want to start with, just your skin types. A lot of clients come to me with dry skin. So obviously as a nutritionist, my role is to help them nourish from inside. So, healthy fats, hydration, making sure that their nutrients are in balance. And that helps the skin to improve and the dryness to improve. But what externally as a dermat would you recommend clients for dry skin? Absolutely dry skin, maybe on the face, on the body.
So before I begin into this, I just want to clear a few basic things. There is a difference in oily skin and hydrated skin, which means the opposite of dry skin is not oily skin. The opposite of dry skin is hydrated skin. Oil is something which is situated in the lower layer of the skin, which are oil glands. Oily skin is hormonally governed, but otherwise, when you talk about dry skin, we are talking only about the water content in the skin, which also means that you can have an oily skin but still dry. You can have enough oil, but your hydration levels in the skin are low. So when we mean hydration, we mean 10% water content in the first layer of the skin. Is that water content what you drink water? No. So the hydration that we talk about, the good food, the hydration is important for a healthy skin. But a dry skin means lack of hydration. When hydration is gone, it means there is the epidermal barrier function, which means the protective layer of your skin is compromised, which then imparts towards early aging, pigmentation, dullness, a whole lot of external damage.
Yeah.
So how do you improve that first layer of the skin? A, you need to use the right kind of products. Or, let me rephrase this. You can compromise on your hydration by using the wrong products. Very often, for example, people who have oily skin think that using a stronger face wash is taking care of their oil. But only thing that face wash is doing is taking away the hydration. Your oil glands are situated so much beneath the skin that a face wash cannot reach them. So that's how the whole drama starts. People who have oily skin always feel that I don't need a moisturizer. And so they've never used a moisturizer in their life. So by the time they reach a certain age, the hydration levels have dipped so much that your skin then starts becoming dry, flaky, and kind of uncomfortable.
Right.
That's one thing. So we say this is physiology. Pathologically, a whole lot of people can have dry skin because that's your skin type, which in lay terms is called atopic dermatitis, where the hydration levels of your skin are inherently compromised, and that's the type of skin you have. So what we say is use a light cleanser, which is detergent-free. Use a moisturizer based on your skin type. So if you have oily skin, use an oil-free moisturizer. If you have non-oily skin, then you can use a regular lotion or cream-based moisturizer. And of course, take care of your diet. Because when you have those green vegetables and stuff like that, which you can tell me better on that, I think you will have the short chain fatty acids as we discussed. And that itself can build the strength of your skin.
Absolutely.
So it's a holistic as well as using the right product.
Yeah, it's also the gut, right? If you have like poor microbiome and dysbiosis in your gut, that also affects the texture of your skin. So when you take care of the good bacteria in your gut, they produce, the short chain fatty acids, they produce butyrate, they produce all of that, which then nourishes your skin.
So in fact, we are now even, it's a bit premature for me to say this, but we are getting into something which are called even skin microbiomes. And we will get there, and I'll talk about it when I reach there. But we are in the process of discovering more about skin microbiomes.
But that's really important, because I think we are really compromising on our skin barrier, the microbiome barrier on our skin, with all these soaps and these chemical detergents that we are using on our body.
All the chemicals that you're using on your body, on your face. If you're talking just about the face right now. All the wrong things that you're using on the face. All the different acids that you're using on your face, all the different skincare that you're using on your face, which Instagram has dished out to you, that use 7-step routine and 3-step routine. So, and when we mean microbiome, skin microbiome, you're not talking just about bacteria. We're talking about virus, we're talking about fungus.
Yeast, everything.
A whole lot of microbiomes.
Yes, it's the entire,
it's an entire jungle out there.
It's a whole garden, I would say, of some beautiful flowers and some thorns which are needed to balance the flowers
so
also.
I think, coming to a basic thing, this is a very science-driven organ when we talk about skin. So, I mean, I'm just wondering if somebody has cardiac ailment, are they going to go and apply a cream on it just because Instagram said so? I mean, the skin is as important an organ as your heart, as your lung, as your liver. Are you going to go on Instagram or to decide what you're going to take if you're suffering from another organ ailment?
No, you won't. And exactly, because it's shown to us in such a way, it's projected in such a way that after using this product, you'll start looking like this. And then that is something that gets people to buy all the skincare and hair care products that you're seeing today in the market, and you don't know what it's doing to your skin. Like different kind of soaps, different kind of face washes, different kind of, like you rightly said, AM, PM routine. And that was one of my questions. Like, you see tons and thousands of products on Instagram, and then people buy them, and then it's like, okay, so the AM skincare routine, these are the steps, so the 7-step or the 8-step, and your nighttime routine is a 5-step routine. So can you throw some light on what are these routines? What is the right AM and PM routine that one needs in general?
Okay, so let me first begin with what's right. So let's now not talk about negatives, let's start with positive. The right thing, you need 3 steps to your skin. Everybody, one is a cleansing routine or a cleanser. You need a moisturizer depending on your skin type, and we are going to talk more about this in detail. Sun protection, as to how important and when, we'll come to that. So if you can protect your skin from the sun, which will help maintain your collagen and will also protect the loss of moisture. It will maintain your skin for a longer period of time. Use a right cleanser and use a moisturizer. Now, on top of that, you can use certain actives depending upon what one needs. So one is never going to need more than 1 or max 2 actives in their life. So there is nothing like 7 step in the morning, 7 in the night. What I think, if I have to generalize it, and this is, I'm just going to give you a general thing.
Yeah.
Everyone would do well by using a vitamin C serum in the morning.
Okay.
Because it's an antioxidant. So it's going to protect your skin from external damage and will help in recovering a little bit of the damage which has happened in the past. So good vitamin C, with which I mean ascorbic acid, which is made from the right raw material and the right percentage. So is it also, another thing is, people say the higher percentage they see on the bottle, the better it is.
Yeah.
Means everything more is good.
Yeah.
Whereas in skin, your mantra is less is more for everything. So it doesn't mean that a higher SPF means good sunscreen. It doesn't mean that higher strength of vitamin C is good. So good strength of vitamin C, which I would say anything between 8 and 10% is a good strength. You can restrict yourself there, which is ascorbic acid and a good raw material. So that's your vitamin C to use in the morning. Use a sunblock. Depending on your skin type, I would always say stick to a mineral one, and I know you're going to throw more questions on me on that.
Yeah, I want to interject here.
Yeah.
I have seen a lot of dermats. Obviously, the propaganda for sunscreen is big. 5 times a day, make sure that you don't step out. When you're at home, apply sunscreen. Okay, I get the point, and I get from where they're coming. But what I need to understand is there are also research studies which are saying how sunscreens are damaging our hormonal health, our internal health. They're causing problems with our reproductive system, and they are also increasing the risk of certain cancers. And these are studies which I have actually absolutely vetted myself and seen it and understood what they're talking about. Now, why is no dermat talking about these chemical sunscreens which are damaging your health? Why are we so hyper focused and so narrow in our vision of only protecting our skin from sun and the cancer that it can cause, but not understanding what that sunscreen is doing to our body internally?
So first is, let's break this down. When we say there are papers, which I don't think there are papers, there are studies.
Studies, yeah.
So we do not have a white paper as yet on any kind of chemical being absorbed into the body, but I will respect it and say any chemical which is applied to the skin can get absorbed if it is put in a larger quantity. So let's bring our focus back to saying that anything which needs to be used daily better be the safest thing that you're using.
Absolutely,
right?
Yeah.
So stick to a mineral sunscreen, which is a physical sunscreen. So there is a difference between a physical blocker and a chemical blocker.
Yeah.
A physical blocker was always existed in sunscreens, but in the past, those physical sunscreens used to leave a tint, like you had the white cast. So they were not popular. That's when chemical sunscreens came into being, because they didn't leave a white cast and they had chemicals which would make that white cast disappear, so it would be like a transparent layer on your skin. I agree, those could have created problems. But with the modern pharma, with the more modern progress we've made in pharma, I think the physical sunscreens are now available in a non-cast manner, and that is a technology which is called the blue ray. So if you have a mineral sunscreen, which is a physical blocker with the blue ray, that will be like you've not applied anything. It is without silicone, it is without any chemicals which can get absorbed. Now, those sunscreens can be really, really good. Let me also go a step ahead and say, I recommend them.
Okay.
Because it does help in protecting your skin. Why is, your second question, I'm not going to bypass any of your questions. Why is no dermat talking about it? I'm going to bring out possibly that our industry is really, really diluted right now. And I also believe because we have a lot of non-dermatologists practicing dermatology. And there is no checking system as to find out, and the only people who could actually do this rightly are the patients. I mean, if they start going to the right person, I am sure a whole lot of myths will get debunked.
Absolutely.
So I do believe that educating the patient or the person coming for a treatment is what is going to bring a change.
Absolutely.
And then they will go to the right person and get the right advice. So, but yes, two things: a physical mineral sunscreen does exist.
Yeah.
In fact, I will go a step ahead and say we are making those in our clinic.
Oh.
I've gotten into products because of this one thing, because there's a whole lot of nonsense going on, which we'll, I think, speak in the last segment.
Yeah.
But we do make a mineral Blu-ray sunscreen which is completely chemical free.
And it doesn't get absorbed into the
doesn't
skin,
get
because our
absorbed.
skin is the largest organ. Whatever you
Absolutely.
put on your skin
Absolutely.
gets into your body.
Absolutely. And in fact, a sunscreen has to be something which doesn't get absorbed. Even for the fact that the name says it's a screen. It's a block. It's a sun block or a sunscreen. It's not
Right.
supposed to get absorbed. It's because it needs to protect from outside.
Yeah.
So yes, you need to use the right one.
Wow. Okay.
So another thing is, that's where the SPF really doesn't matter. It's not that a higher SPF means more protection.
Oh yeah, I wanted to ask you that
Yeah.
people say 50 and 50, it should be
No.
30 plus.
30 is good enough.
Yeah.
In fact, 28 is a right thing. 28
sweet
plus
spot.
is good enough. What you need to look at is a broad spectrum. It should say broad spectrum physical sunscreen. And broad spectrum means it will protect against UVA and B. And when you have a Blu-ray technology in that, it also kind of protects against a little bit of the UV radiation you get from your screens.
Okay.
So that's what you need to look at. And I don't think you need to look into SPF of, I just saw somewhere there was an SPF of 85.
Oh my God.
It really freaked me out. I was on a trip and I was at one of the duty free, and at them they're saying, oh, you must take this, you're going to your beach holiday, it's 90 or 85. I said, thank you so much. But yeah.
And applying it 5 times a day is the norm?
Why 5 times? No, you need to apply it so yes, let's break it down simple. Apply it in the morning, reapply it in the afternoon, and you're fine.
You're good, right?
Yeah.
So twice. Which is
Twice. And that also,
good. Or every time you wash your face, probably apply it
why
after
would
that.
you wash your face more
Just in
often?
general, say you've gone out, you've come back, you've had a sweaty day, or you just feel really oily or
Yes.
sticky.
Then
you
it's
want to
okay,
wash
but
your
then
face.
If you are washing your face after 5 p.m. in the evening, maybe you don't need it.
Yeah, of course.
Right,
But
so-
okay. Anyways, what we hear about sunscreens and the information that we get out there again on Instagram, on social media is, I think, a little bit too much.
It's too much, and sometimes I also would like to, when I see influencers, when I see Instagram, I realize that if somebody has to put up a post every day, what new are they going to find? They're going to twist the same thing to the point that it will start sounding wrong.
And I also feel it's like Chinese whispers, na?
Yes.
One doctor saying the other
Yes.
one feels like, oh, that's the right information, let me say that, because then you're getting more views on it,
Yeah,
and then
yeah,
it's like,
yeah.
okay, so it's become like a Chinese whisper. So whatever one person is saying is
I do
is
hope
what everyone is
soonest-
speaking, but then
I do hope that soonest medical information gets filtered, nutritional information gets filtered on Instagram, because
Yeah.
since it's a free platform, people will follow what is out there.
I think they should start having authenticity checks
Something.
these platforms, and
Something.
let only people who are like genuinely educated in that stream or have formal education in that get the right to speak about it, because
Yeah.
otherwise we're damaging our
We are damaging
our people literally.
damaging the people in the physical form, and we are also damaging them emotionally.
Absolutely.
Think about it. If somebody is dying to, I'll talk from nutrition point. It's dying to lose weight, and follows the Instagram, and has a different diet every single day, and puts your mind and starts following the diet, and no change happens after 6 months. They get emotionally damaged.
That is true, but there are some people who are also following diets that work, but work only for the moment,
So
and they're
that's
not
called not
sustainable.
working.
So keto, like people started doing keto some years back,
Yeah.
and they started dropping weight. I've had clients who've come to me after keto and literally pleaded and begged and cried in front of me, saying that, Neha, my body is so stubborn right now. I've
Yeah.
gained all the weight back. It's not responding. And when I've checked their blood work, it's evident that their liver is definitely compromised. Gut health is compromised. Nutrients are deficient. That's because you've gone a very extreme route.
you-
You've taken a very extreme step to reach to your
And
goal.
you smell like a keto diet.
Yeah.
I mean, I've had patients who
Yeah.
come.
Yeah.
When
Ketones, yeah, of course.
Ketones, you can actually, I know it when they enter my consulting room that this one is on a,
Yeah.
that you could smell the ketosis. So, yes, you're right. I wish there is some authenticity check
Yeah.
on what people are saying.
Absolutely. Now, circling back on actives, because
Yeah.
I interjected you at the sunscreen. Tell me, what are the actives? You said vitamin C is
So I
one
said
thing
vitamin
that.
C is one.
So sorry, I'm just reiterating what you said. You start with a cleanser.
Start with a cleanser which is detergent free.
Yeah. So what kind of cleansers can one use on the face, and what's the pH of the cleanser? Because
So pH has to be the 5.5, which is normally
slightly acidic.
Slightly acidic, because you're never going to find a neutral pH. Even if people say that it is neutral, slightly acidic is okay. Have a detergent free one. When we talk about detergent free, it's important to understand anything which is detergent free may not be foaming. Secondly, it will never be in a cake form, because the minute you give a form to a cleanser, you have to add detergent. So it will be in a face wash or cleansing lotion. Both are the same. Start with that, apply a vitamin C, and use a sunscreen.
So this toner and all that is not needed?
Toner is not required for the Indian skins. Please don't kill me for this, but it is not required. If someone does need to use a toner, so-called, we will come to that, is for specific skin concerns. As a normal routine, you don't need a toner. So this is your morning one. At night, I would say that just to keep it a bit more generalized, if you are 30 plus, you could start using a retinol. Now, once you start using a retinol, it is important what kind of retinol you're using. So use some, you don't need anything which is above 0.1 or 0.2% actually for a regular thing. And use something which is not very harsh on your skin. Even then, retinol is something which your skin will have to get used to. So I always tell my patients that start using it 2 times a week.
Okay, to start with.
So the
and
skin space it. So use it on a Monday or a Thursday.
Yeah, so the skin gets time to adapt to it.
Yes, use very little of it. Start only on your cheeks, forehead and chin. Don't go close to the eye, corner of the nose and the corner of the mouth. Don't start with the neck because it can irritate. Once your skin starts getting used to it, you can make the retinol 3 to 4 times a week.
How about bakuchiol? Because I've heard it's a plant active and it's similar to retinol, but it's milder.
Active. Use it only if you cannot tolerate a retinol.
Okay.
But otherwise, if you can tolerate a retinol, which eventually everyone can if you're using the right one and in the right way, then you stick to a retinol.
Okay.
And then you could use a moisturizer either on top of the retinol or even under the retinol. So if you're not tolerating a retinol, you can first put a moisturizer, wait for some time, half an hour, 40 minutes, and then put a retinol on top of it.
Okay.
Because an active will get absorbed in your skin irrespective if it is a right active.
So at night it's cleansing, retinol and moisturizer. Or
if you're 30
either
plus.
ways. Yeah, if you're 30 plus.
If you are under 30 and you have normal skin, then stick to just a moisturizer at night. If you have an acne prone skin, then you can use something which has 1% salicylic acid in that, in a serum form. So pick it up if required.
Okay.
So this is a in general routine.
Yeah, it's a general rule of thumb. But so morning no moisturizer. So it's just cleansing,
can use a
vitamin C, and
because during the day, if your skin can get sticky. So you may not want to use a moisturizer. But if your skin is dry, then once you use a vitamin C, you can use a moisturizer on top of it and then use the sunblock.
Okay.
Now that moisturizer also depends upon your skin
type, whether it's oily, it's dry.
Yeah, so we have also started making a moisturizer which is only with sodium hyaluronate. Now that is something which gives hydration and it is in a gel to lotion form, so it can be used by either dry or oily skin, because sometimes we cannot confuse people too much. We can't say this moisturizer, lotion form, gel form. So we can have a moisturizer which can be used by either.
Okay.
So that also we can look into.
Okay.
And yes, everything needs to be fragrance-free, please.
Yes, because fragrance is very toxic.
Very toxic.
And people don't realize if it smells good, they buy the product because, oh my God, I smell so good.
Yes.
But darling, you smell so good, but your body is getting damaged within,
and that
because
is what
fragrance
is getting absorbed, because it's also fragrance. The minute you add is alcohol-based, so it's a good medium for products to get absorbed
into the skin.
Yes. So
and
you
then
don't use fragrance.
Oh my God. fragrance is the most toxic thing
Yes,
ever.
yes.
Any kind of fragrance, your perfumes, your air fresheners, your car fresheners,
Depending on which one you're
and
using
the
and how you're
products.
using.
Yeah. I mean, unless it's made with essential oils and certified natural and clean, you
Or it is has to
cannot
be.
take a chance.
I'm not sure about the natural bit, but I would like to say that it has to be. Sometimes natural is bad, because when you certify your product as natural, there is no FDA check. So there is no, anybody can build up and say I'm building a fragrance and it's natural. You need to have something which is passed through your FDA, where you can see the contents and where you can match the pH. So sometimes something which is formulated in a lab is way more safer than
Safe.
something which is made from a plant.
Yeah, but clean and not toxic for your body.
That is the
That's
right word,
the idea,
non-toxic.
basically.
Yes,
Non-toxic
absolutely.
and non-damaging to
Absolutely.
you in any other
Yes.
way. Because it doesn't just damage your body once it's absorbed. It's also
You're inhaling
it, and
Totally, the
aerosols are
fumes.
getting into your system,
You're
and then
inhaling them.
and then we wonder
Yeah.
why do girls have PCOS, infertility, and so many
How does it-
reproductive
how-
issues,
yeah.
hair fall,
True.
all of that. I
Yes.
mean, you can't expect to put toxins in your body and expect great
Yes.
results, right?
Yes.
All right, coming to my next thing is acne. I think this is one very, very, very common problem. I had suffered with acne when I got married, like maybe 10, 12 years back, 2 years into
Yeah.
marriage, and I had my entire, both the cheeks were filled with acne. Obviously, lifestyle change, you're in a new family, eating habits have changed. You're also, you're maybe not taking so much care of yourself because you're socializing, you're going out, you're eating, you're just having a good time. And that was, showing on my skin. So when I went to my dermat at that point, she said, Neha, give up dairy. And I was a nutritionist, a very typical, stereotypical nutritionist at that point, who was like, what? How do I give up my dairy? Like, are you okay? Where will I get my protein and calcium from? The same thing that we hear every time when someone says give up dairy. And then I, of course, read about it because I'm like, where is this coming from? And I saw some studies, I saw some papers talking about dairy and how inflammatory it can be for the skin. So I reduced it, I gave it up. I slowly, steadily got off dairy. And of course, with the right treatments and stuff, my acne got better. And I turned vegan a couple of years after that. That's a story for the later. But in general, I realized that dairy causes a lot of inflammation. Have you also seen that with your clients and people who come with acne?
Dairy actually does not cause inflammation. But here's the thing. The dairy that we have can cause inflammation.
The modern dairy.
The modern dairy, because your cattle is induced with oxytocin. That is what is causing the inflammation in the milk that you're having.
Yeah.
So it would be wrong to say dairy causes inflammation, because I will also say this. When people have acne and they are vegetarians and they're not getting enough of amino acids, I will not even go to calcium and all. What I tell them is give up dairy, but you can have your curd and buttermilk. Now, when you have that, I've seen the gut got better. The oxytocin part of the dairy was taken out, and we could still heal the acne. So, yes, we don't need to go extreme and say stop having milk. We can say you can have milk in a different form, with which I mean which has lactobacillus. So, yes, the yogurt and the buttermilk was helping. Does diet play a role in acne? Now, if you take my textbook and open it, it says diet has no role to play in acne.
Yeah.
That's the modern MD dermatology, ancient, modern, and it will continue to say diet does not have a role in acne. But that diet, what we were talking about, is when we were sticking to
Healthy food in
diet
general.
without preservatives.
Yeah.
But now, if I'm asked again, that does diet have a role in acne? I would shift it and say altered diet does have a role in acne, with which I mean alcohol, with which I mean anything which is sugar, can increase your acne. Because that can be hormonally damaging.
Right.
And that can also invite more microbiomes from outside. So how the acne process works, the reason why you get acne is always because your hormones are not doing their job well. That is the baseline. Now, hormones not doing the job well can be due to multiple reasons. It could be genetic, it could be age, it could also be stress.
Stress, sleep, food, so
everything.
many factors.
So stress, when I say, I mean everything, physical
Yeah.
and mental. Physical is not eating well, not sleeping well, and mental is mental.
Overthinking, yeah.
So that stress can lead to stimulation of your oil glands, which produce more oil. That oil will invite more bacteria, and that bacteria will cause acne. So that's from lower
how
down
it
up.
progresses, yeah.
And that is why if we can reduce the physical stress, we can probably better the hormones. Also, another thing I want to bring to your notice, because you're talking about acne and marriage. I've had a lot of girls who get married in their late 20s, and they come to me just about when they're 30 and 30, and they have a whole lot of acne when they come. Let me also tell you this, that you will get acne whenever your body is not following the right physiological process. So there was a time when people used to get married when they're in their early 20s and have kids and stuff like that at the right time. No, at that time. And everything would be smooth. But now we plan our lives. We also plan our lives because we live longer. We don't have to get married in the 20s. We don't have to conceive in the 20s. We're going to live till 80. So we can very well get married in our 30s and probably start your reproductive cycle whenever you want. Now the body is not attuned to that. So those ovaries are into a hyper mode, and you can get acne when you're in your early 30s. And that is your body's sign of hormonally calming down.
Okay.
And now that calm down doesn't have to be that you go and conceive. That calm down also can be get into a physical exercise, start working out, eat right, sleep well.
Self-care, basically.
Self-care.
Start taking care of yourself.
So everything is the same and still different. Your body anatomy, everything is still the same. But what your anatomy needs now, because of the modern life, is a little different.
Also, talking about acne, what I've commonly seen with my clients, what they come with is a prescription of isotretinoin that the doctor has
Thank you so
given
much
them.
for asking this.
And isotretinoin, we all know it's a fact, and it's also proven that it causes dryness and gut issues and liver problems if taken for a long period of time. And I've had clients come to me saying that the doctors put me on isotretinoin for 6 months because they had active, aggressive cystic acne. And I've literally asked my clients, please tell your doctor to wean you off isotretinoin, because I want to work on your gut health, and I want to make sure that we correct it from inside, we reduce the inflammation, we clean up all the toxins through diet, lifestyle, and just work on your mental, emotional health and stuff. Because as a integrative health coach, that's what I do. They go back to the doctor, they tell the doctor they don't want to take it, doctor removes it for them. We work on their gut health and we work on their overall health, and of course the doctor does any sort of treatments holistically, externally. Clean face after some months. My question is, when that can happen in a holistic way and a natural way, why is isotretinoin prescribed as the first line of treatment even in the early stages of acne?
So let me now also negate you on this one. Isotretinoin is a wonderful drug. But understand this, it's a drug.
Yeah.
It needs prescription. It needs to be taken in the right way. I use isotretinoin a lot in my practice.
Okay.
Coming to the second question, why is it the first line therapy? There are certain skin conditions when we see, and I see an acne, I know nothing else will work on this but isotretinoin. Because the other thing that you will have to give is a long course of antibiotics like doxycycline. You have to weigh the risk versus benefits and give isotretinoin.
Okay.
Third thing, when you said 6 months, the course of isotretinoin is 4 to 6 months. Now coming to another big fact. So these are facts of a medicine, right? Most patients, if you have prescribed them once, because they see wonderful results with isotretinoin and they believe it is an acne medication, or they treat themselves with isotretinoin as and when they want.
And that
I've had
is what
people
damages.
who will take an isotretinoin when they then break out into 2 acne. Here, the problem is also with your pharmacist and chemist. You cannot give isotretinoin without a prescription A. Second thing, your second question is about gut health and everything. While you're on isotretinoin, you need to do a blood examination once every month to know where you are, because you will need your lipid profile, you will need your LFT and your RFT to know how it is helping your or damaging anything inside, and your dose depends upon that. So if it's given in the right dose, prescribed by the right doctor who is doing the right investigations, it's a wonderful drug. Coming to mental health issues. Yes, there are some people who do get more anxious when we put them on isotretinoin. But remember one thing, a severe acne can make somebody way more anxious than what isotretinoin can.
Agreed.
So we have to understand whom to give it
pros
to
and cons.
and whom to not give it to. No drug, Neha, is bad. Every
Yeah.
drug is made for a reason.
Yeah.
It becomes bad when it is misused.
Absolutely, and I
That's
love
the
that
whole
point
thing.
because drugs
Yeah.
are great if you have to work on something that's acute. They're life saving in acute situations. But what is happening now, even in the medical industry and even in the dermat industry, people are giving drugs as the first line of treatment for a lot of problems which can be managed with lifestyle and which can be managed holistically.
Sometimes, Neha, acne per se cannot be managed just by lifestyle. Lifestyle can prevent acne. You can't manage it. So, yes, if you have a good lifestyle, if you have an acne prone skin, your natural ways of dealing it will prevent the acne. But
Yeah.
and you may need your drugs to take care of the acne, and then what happens is once you've taken care of the acne, that's when your lifestyle comes into picture, so that you don't get into this repeat mode.
Yeah.
So skin is a combination of
Agreed.
nutrition and medicine. So when you have a problem, you need to heal it with medicine. So in fact, when patients come to me with a skin problem which is acute and they say I don't want medicines, I say then I cannot help you. Because that I can help you with only if I have to maintain your skin.
Right.
So sometimes we need to address the issue. Coming to why we need isotretinoin at times, because it's easier to take care of an acne and impossible to take care of a scar. So once your acne leaves a scar, which is like a hole or a khadda, then you're in trouble.
Yeah, so my next question was just
Yeah.
that. How does one deal with that? Open pores, acne scars. Is there any way naturally that you can, reduce the dent and reduce the scarring on your face?
No. One is once a scar, always a scar is what you need to underline. There is, when you mean natural, let me put it, there are a lot of non-damaging ways to look after scars. Natural, just by applying a cream, your scar is not going to go.
No, but any natural things that one can do?
What do you mean by natural?
Any
things?
natural ingredients, your kitchen ingredients, nothing
No.
works.
First of all, kitchen ingredients, please put in your mouth and your gut. It will help you more. Don't put it on your skin, please. Because your skin is not a semi-permeable membrane that whatever tomatoes and cucumber you apply on it will get inside. And if you really feel that your skin is still getting better by applying the tomato or the
Papaya.
cucumber, understand what is helping. It's not the papaya. It's the acid released by the papaya which is helping. Or when you're applying a tomato on your skin, the acid released by those tomatoes is helping your skin, and as is with cucumber. So when you mean natural, every natural product has an acid, and that is what is helping.
Right.
So when we also say that we are applying certain non-toxic things, they are also made from plants only. Glycolic acid is made from a plant.
Yeah.
As is a beta hydroxy acid, which is salicylic acid. So instead of putting the kitchen ingredients, if you eat it, you're going to have a better gut, and that's why you'll have a better skin. So every skin problem will need medication, but we can definitely prevent it in the future by maintaining a lifestyle.
Right.
So it's a combination.
Yeah. So what you're trying to say is that treat it with medicine, but don't stay on the medicine for very
Absolutely.
long. Yeah,
The gist of medicine is short term.
Yeah.
We cannot be on a drug long term.
The same as with diabetes and stuff, but with the medical industry now, the
No, but
propagation
diabetes
is.
you may need lifelong.
That's what I'm saying. Initially, when you just. So, as a functional medicine practitioner, we view it very differently. We try to nip it in the bud maybe 5 years before somebody becomes a diabetic. Because
You will never
we
be able
understand.
to nip it in the bud if it is a genetic thing. It will show up without diet as well.
If it's a genetic thing, but epigenetics play a very big role. Unless they have a genetic snip,
yeah.
then it's different. But if they don't, and it's just that, okay, my mother had diabetes, so I have, well, no, you don't need to have the same fate
If you
like
have
your
a
mother.
lifestyle, you will not have it.
That's what I'm saying. Epigenetics
Totally.
play a very important role. My mother could have had like 10 issues. Not necessarily I'll get all 10 of them, unless my lifestyle is like her. If I live like her, think like her, and I emote like her.
We have to learn
That
from what
is
we see.
that's extremely important. Yeah.
Yes.
Because I've had clients with acne, and when they come to me with acne, before they've even gone to a dermat, I actually tell them, let's just try healing it naturally first, and if it doesn't, then we'll take the dermat route. And for so many people, it's just become okay with lifestyle. So I've even seen
on
that.
the kind of acne you've had.
Yeah, maybe.
Because if you have a typically seborrheic, which I mean an oily skin, and you have a skin texture with open pores and a genetic acne, which, what do you mean by genetic acne is the gene which has hormonal imbalance. You will need to meet a dermat first so that you don't scar. And you also need to see, like I always, when a daughter comes with the mother for acne, I try to look at the mother's skin and I know. And then I also sometimes, and thankfully now we have even fathers coming with their daughters. And I try to see their skin and I know which one to put on which medication. Because if I see that this is not an acne prone skin, then we can help with just applications. But if it's an acne prone skin, we better not wait till the patient scars. And it is a huge mental scar for them as well.
Absolutely.
Today's day is such that a teenager with acne has so much peer pressure, and then they try to put so much makeup to hide that acne that it's only going to aggravate and complicate that problem. So choosing whom to give what is always
extremely important. No, absolutely. I mean, I've been through that process and I know how it feels.
And years of experience has now taught, at least me, that when I see a person entering into my office, I also get that, and I don't know if you believe in energies and vibes.
Absolutely.
So when they come in with that energy, we know where is a depressive energy, where is a negative energy. So you know whom to...
Absolutely.
It's
which route to take, because then you know that this person will be able to handle it without, or this person will not be able to handle it. So they need more mental satisfaction at this point than anything else. And that's the role of a coach and a doctor and an expert, right? Which these Instagram so-called self-proclaimed experts do not have.
I agree. Completely. It is absolutely
because only experience teaches you this. Nothing else can.
You know whom to not touch when they come into your clinic.
I mean, we didn't learn it on day one. We also learned it over the years when we worked with so many clients.
The first thing which works is your gut. Everything. Your gut tells you
so
what to
with
do
your instincts as well, right? So Falguni, shifting gears a bit, I want to talk about pigmentation because that's a very common sight now. You see people with melasma, pigmentation on the forehead, on the side of the cheeks. It's become more common than before, right? So what is the reason for these pigmentations and how can one deal with it naturally, or are there any medical treatments which are not damaging to your body and to your health that one can do for these pigmentations?
So pigmentation is a big word. It means increase in melanin. But there is also, you spoke about a lot of pigmentation in one word, whereas everything is a different illness. So melasma is a hormonal illness wherein the melanocytes which produce the pigment, the cells which produce the pigment are in a larger quantity. Then you have pigmentation, which could be just patchiness, where your skin is dark in certain areas, light in certain areas. There are a whole lot of medical conditions which can lead to pigmentations, which is called lichen planus pigmentosa, LPP, that is just one of them. Then you have melanosis, which is a different kind. So there are a lot of... Every pigment is not just pigmentation. So you need to understand first what kind of pigmentation you have. If it is melasma, it is a lot to do with your hormones. It will never really go. It will get healed, but you will always have a tendency for it to come back. Similarly, patchiness of the skin is the easiest thing. So from what I understand in this question, the only thing which is more of a lifestyle based is only the patchiness, wherein your skin is dark in certain areas, light in certain areas. And what we mean by that is, generally this kind of pigmentation is associated with skin dryness. So like we went to the first thing, the hydration levels of the skin are compromised, which I mean the epidermal barrier function. When that is low, your skin is damaged from outside due to the pollution, due to UV intensity, excuse me, and a lot of other things. So this damage is more from outside. How can we heal this? One is you build up on your hydration levels, better your lifestyle, use a sunscreen, and you can use certain lightening agents as a skincare routine at home, with which I mean vitamin C serum, which will help you by using it during the day. And at night, you could use something which is a mix of arbutin or kojic acid. All these are very safe for the skin, and even azelaic acid. So you will have to, it is always better to go to a dermatologist, find out what can be used by your skin and use that as in your skincare routine as an active. But remember, pigmentation is an extremely challenging thing for a dermatologist to heal. and for the patient to perceive as well, because it is something which you'll have to work on lifelong. So if you will ask me that is there a treatment for pigmentation, I will say let's change that word to we can control your pigmentation.
Okay.
It is something for which you may have to take multiple visits to your dermatologist, but if done rightly and with the right treatments, it definitely can make a difference.
Okay.
Breaking it down to what treatments can be done, there are certain peels which can be done depending upon your skin type. We have, and the peels then are divided as epidermal or dermal. That means if your pigmentation is only external, we could use an epidermal peel, but if it's coming from within out, then we will have to do a dermal peel. Dermis means going to the second layer of the skin. There are certain lasers which we call as a Q-switch laser. If you're using the right laser, the right technology and the right make, because now what has happened is these lasers are great, but because people want to buy cheaper lasers, they are going to, please pardon this, I'm not being racist, but the so-called Chinese makes, etc.
Right.
Wherein they're using not the right technology, or maybe they're not the right machine.
Cheaper
technology. Now what happens is when you go to a dermatologist, and if you're not well aware and they say that, okay, for example, we're going to use a Q-switch laser. Q-switch is a very good technology, but what matters is also, are you using the cheaper one? So by using the cheaper technology, you may end up harming the skin more than healing it. Now the same Q-switch, if it's a US FDA or a good FDA approved system, can do miracles to your skin. So the kind of technology, the kind of system matters, and that is why, again, going to a good dermatologist who's certified, board certified, is a very important thing, because sometimes your pigmentation will require help.
Right.
But if it is patchiness, you can start using the right actives, use good hydration, use a good sunscreen, and you can do the job.
Of course, also antioxidants in your diet is extremely important,
even
right?
antioxidants, you can also take them as oral nutraceuticals, depending upon what kind of pigmentation you have.
Yeah.
So it's going to be again a holistic way.
Yeah.
Pigmentation is almost always holistic because it is a combination of treatments done in the clinic and what you do with yourself at home.
Absolutely.
These two things will have to be done together.
And I think that's the case with every issue, but more so maybe with pigmentation.
No, actually for skin, maybe most of the issues.
Most of the issues.
A lot of maintenance goes in. So when a patient comes to my clinic, and I just want to make a note, make you, put this in the universe, that a person coming to a skin clinic should always be a patient and not a client.
And why do you say so?
Because client means you're talking about a non-medical approach. Most often, because clients are what go, when you're going to a salon, it's okay to be called a client. But when you're coming to a skin clinic, if a person comes as a patient, the patient-doctor relationship will stay in a way that we are going to give you medical and science-based solutions.
Right.
Because the minute you say client, it can also become just a beauty solution. And here we are talking about treating your skin with respect as a skin organ and healing the skin rather than just treating the skin from outside.
Yeah, makes sense.
So when you color your hair, you say this is color treated hair. What we're talking about is we are healing your skin.
Right.
You're coming to us with a reason, and we're trying to make your skin healthy, and a healthy skin is anyways going to look good.
That's true.
So I like calling them patients.
Okay.
Yeah.
I liked how you spoke about pigmentation because it really helps one understand what to do,
Yes.
because most people otherwise are only focusing topically on, for pigmentation
Yes.
and not understanding it's such a long process.
Absolutely.
And it's so deep within that needs
It
to
is
be
always deep
healed.
within, yes.
Yeah, and you just can't do stuff topically and expect things to magically get better.
Yes,
That's amazing.
yes.
And coming to dark lips now, because of course a lot of people have dark lips, and it somewhere takes away your confidence. Yes, you can apply lipsticks,
Yes,
which
yes.
hides it, but then when you're without lipsticks, you obviously want nice pink lips. What is the reason for dark lips, and what are the ways that one can reduce the darkness? Because I've also seen a lot of treatments, like those lip tattoos and lip coloring,
Now those
laser
are not
things.
treatments; those are again cosmetics. They are not
Cosmetics.
treatments.
It's a cosmetic treatment, but what is the right route to take for this?
So dark lips could be genetic. There are some people who have darker lips. That's the way it is. Now, can we really do something about that? We can probably hydrate your lips better, because of which anything which has water in them, right? Hydration is a good reflector of light. So if you see, when light falls on a swimming pool, the water shines. Why? Because water reflects light. So if you can keep your lips hydrated, they will automatically look less dark. So using a right lip balm with an SPF is a good idea. The other causes of dark lips, of course, I'm not going into the smoking and all bit because that is obvious. Certain deficiencies can make your lip dark as well. So if a folic acid deficiency is one very common reason why the corners of your lips go dry. Using the wrong lipstick also makes your lips go dry because nowadays, because everybody uses matte lipsticks, because people are looking for the stay-on lipsticks and they're looking at lip tints and not lipsticks. Lip tints can dry your lips and eventually lips can go dry, get dark, because again, as with the skin, because the hydration levels of your lips will go down, it is more prone to damage from outside. So see to it that try using cream-based lipsticks more than matte lipsticks. And if you're using a matte lipstick, try using a lip balm before you put the lipstick.
Right.
And also see to it that you take your lipsticks off with a makeup remover. Don't try to just wash it off. Take it off with a makeup remover. Once you take it off, use a lip balm and sleep with it, like a lip mask. This helps. Also, there are retinol-based lip scrubs as well.
Nice.
So once or twice a week, you could use that.
Okay.
If you exfoliate your lips, here I'm going to give you a natural cure.
Yeah.
If you exfoliate your lips, the new skin which is formed will have more hydration. A good way of exfoliating your lips, you could do it at home by using some sugar. You could use sugar, just rub it on your lips, and the not that fine sugar, the coarse one. Rub it on your lips, wipe it off, and you can use a lip balm on top of it.
Nice.
So these are some ways you could help with maintaining your lip color.
And what about those cosmetic treatments?
Cosmetic treatments we can do, there are certain peels that can be done. These are retinol-based peels which we do in the clinic, which are not to be done very often. Once in 2-3 months is a good idea. We also do the Q-switch laser to lighten the lips. But most often, we try to put the hydration back into the lip. So these are called skin boosters. These are hyaluronic acids, which are not fillers. These are hyaluronic acid, which is just in the hydration form. And they are to be injected into your lips.
So it goes into the cells.
Goes into the right layer, and you put hyaluronic acid over there, so you get the natural hydration back.
Nice.
And these are not fillers.
Nice.
So these are just ways of boosting your skin hydration.
Understood.
They really help.
Really nice. Okay. Amazing. And of course, talking about anti-aging now.
Yeah.
There's a lot of buzz about Botox and fillers, and
yeah.
I don't know, somehow just intuitively I don't feel good about it when I hear the word. I don't know, I've never tried it, never wished to try it, but are there any natural ways to take care of your wrinkles and sagging skin or aging, the aging on the skin that you see with after 30? Is there a natural way without these Botox and fillers?
So first is understand that once you have a wrinkle and you don't want a wrinkle, you don't have a choice but to take the Botox. So one is accept. If you don't want to get into botulinum. So before we go into this, I'm just going to use the right word. Botox is a brand name. The drug name is actually botulinum toxin.
Okay.
And Botox is one brand. The other brand is Xeomin. There is another one called Dysport. All of them are good enough. But Botox had the first mover advantage. So it's become like Xerox. The brand name has become equivalent to a drug name. So the drug is botulinum toxin. If you have a wrinkle, you don't want it, then you better not waste your time on anything and go and get your Botox done, because the more you wait, the deeper the wrinkles get. Is there a natural way? A natural way will always help is always the solution to prevent or to push back the aging. Everything that we spoke about till now will help you age better.
Yeah.
Diet, nutrition, sunscreen,
Yeah,
a good
AM, PM
skincare
routine. Yeah.
Then getting into a term which was thrown to me by Instagram called collagen banking. What it means is you stimulate your collagen while it is active. So if we break down the science, till the age of 30, we are actively making collagen into your skin. 30 to 40 is the decade where the collagen is not getting built, but you're not losing either. So you have the set amount of collagen, and 40 onwards, your collagen is depleting and you're not even making anymore. So in that decade of 30 to 40, when your collagen is stagnant, you can start your collagen banking. So we do certain simple procedures called radio frequency, microneedling, where you can stimulate your own collagen, and this collagen can then last you longer than what it would have otherwise.
Yeah, so you
So
don't
the
need
youth
collagen
stays.
supplements and all then.
Collagen supplements are a great source of protein intake, right? So 80% of the protein in your body is collagen.
Right.
So by taking oral collagen, you're not building collagen into the skin, but you're building the protein in your body, which is indirectly helping the
Using
skin.
whatever the body
Yeah?
uses it for.
So
then.
it is a great way of oral nutrition. So radio frequency 1. Then we have something called a new concept, which is great, which I love and I use a lot in my practice. It's called biostimulation or
what is that?
biostimulators. Biostimulators are products which stimulate your own biology for it to last longer. So these are not Botoxes, these are not botulinum toxins or fillers. These are products like PDRN, which is polynucleotides. These are products like calcium hydroxylapatite and hyaluronic acid. These help in stimulating your own collagen for it to last longer.
Okay.
I think the world is now going towards a natural aging process.
Absolutely.
And you can age naturally by using biostimulators starting in your 30s. So yes, you will have wrinkles, but they will not make you look old.
Yeah.
So the whole thing is you will have youth. You don't necessarily need to be young.
Yeah, and a radiant skin and a more,
Yes.
younger looking skin even at your age.
Even at an age, yeah.
Because with these Botox and stuff, I have seen celebrities that when they smile, their lips don't move, their eyes have become smaller. The face looks like it's
Different.
Face
Now
looks
the thing
different and
is-
it looks rigid. There
Now
is
the-
no fluidity in
Now
the
the
face.
thing is, what you see is a bad result. Good results are not seen because it's a good result.
Yeah, of course.
So
right.
that is the part which I say when people come and say that this causes this. That's because you noticed it because it was bad.
Bad.
You are for 5 bad faces, you're not noticing the other 95 which were nicely done. Yes, the bad jobs are always out there to be seen. And what is a bad job? I feel overdoing anything is bad. Anything which is done in the right way, right quantity, and minimally will always be taken as natural or a natural result.
Yeah.
Is it wrong to do botulinum? No. Is it wrong to do excess of botulinum? Yes. So while someone may not like a wrinkle, and if it is hampering their confidence, please go ahead and do it. If you say that I am not bothered about wrinkles, but I want to have good skin, we have an option for that as well.
Awesome. That's a great relief,
Yeah, so what I'm trying to say is each its own. Whatever you do, if you're doing it scientifically in the nice way, I think you're safe. So yes, we have better ways of dealing with aging than than botulinums and fillers now because we have biostimulators. And because we are aware and because we want to stay relevant for a long period of time. When I mean relevant also this is more on a philosophical note. I will say that there was a time when the average age, the average age where a person could live was 56. That was what was considered as your lifespan. Now with modern medicine, most of us are going to live till 80, thankfully, and maybe some people will live more as well. There was a time when you would retire at 56. Now you don't want to retire till 80.
Yeah.
If I don't want to do, if I am going to live till 80, I'd rather work till I am 80 minus 1 day.
Same.
Right? Now, why will someone let you work when there are younger people coming all the time? People would want younger people working.
Yeah.
Like today at 75, if someone is going to go for a job and there is someone who's 30, the 30-year-old will be taken.
Yeah.
So today looking youthful has become also a need to stay relevant.
Yeah, so
Because
true.
I may have knowledge of a 30-year-old, but if I'm going to look 70, I may not be considered in that category.
Fit for the role.
Yeah. So why not start looking youthful at a younger age?
That makes so much sense.
So yes.
Yeah. Of course, that, and also do it for your confidence, and do it just
Yeah,
to feel
just
good about
whatever makes you feel
yourself.
good,
Yeah,
yes.
but do it the right way and do what makes you feel comfortable.
Absolutely.
And I'm so glad that you said that there are better ways without Botox and fillers to even
Yes,
do that. So
yes.
that's great, guys. You now know that if you want to stay youthful,
You can,
uh, you know what options you have to choose from.
yes, yes.
Yeah. And coming to the next thing is hirsutism.
Yeah.
I see a lot of PCOS girls with,
Excess hair.
excess hair on the chin, face, and of course that hampers their confidence to another level. I've seen girls crying in front of me saying that I feel like a man, my friends tease me, I don't feel
Yeah.
like going out of the house. They stop socializing. And it is, it is absolutely scarring in so many ways, mentally, emotionally, to see yourself in the mirror with that kind of hair and people teasing you and stuff. It's definitely not easy for these girls. How can girls get over this hirsutism problem? Of course, internally taking care of the
Yeah.
insulin resistance, inflammation, and everything that causes PCOS, but externally, what is it that they can do?
Externally, the only thing that can look after or take away the unwanted hair is the laser hair reduction.
Does that work for PCOS girls? Because that is what I also wanted to ask you.
It works for PCOS girls if you are handling the PCOS first and then doing the laser.
Yeah.
You cannot have PCOS and not taking care of the hormones and then doing just the laser.
Doesn't work, right?
Means you will just keep doing the laser on and on and
No,
on.
but it comes back. What I'm saying is, even after that, the reduction doesn't happen, right?
The reduction will happen when your hormones get naturally better as well. Now,
Yeah.
coming to PCOS, eventually PCOS will settle when you conceive and
Yeah.
when your hormonal cycle. So, one is you start doing keep doing a laser till then. But what is the point of doing laser lifelong? You might as well might as well wax lifelong. Why are you doing your laser hair reduction? A, you don't want to damage your skin by repeated waxings. Also, waxing and threading and raising repeatedly can not only make the hair thicker, but it also gives that skin greenish color hue, which you don't want.
Yeah.
Right? It hampers with the quality of your skin, which you don't want, definitely not on the face. So yes, you will have to get into laser hair reduction. What do you need to do before you get into laser hair reduction? A, if you are overweight, look into your weight. Follow a good nutrition. Get into exercising. It's very, very important.
Yeah.
Visit your gynaec or endocrine and see what you can do about your PCOS. Start with all this and then simultaneously do your laser. So if somebody has hirsute, is a hirsute, comes to me and I can see that the hormones are haywire and says, no, but I want to get rid of the hair. I said, I'm sorry, sweetheart, I can't do this for you.
That's a good approach.
You have to go get the hormones checked, get into weight loss, get into diet, meet a nutritionist, and we do all this simultaneously. Just me, you're only going to give me a bad name.
Yeah,
You will go
exactly.
out and say, I did the laser here, it didn't work.
Yeah, and I've
That
had
is-
clients who had active PCOS.
Yeah.
Before coming to me to take care of their PCOS, they went to the dermat, got the laser done,
No,
and they said,
it'll
we've
come
done
back.
like 10 rounds and it's not gotten okay. I said,
Yes.
because darling, you first have to take
Or do it simultaneously.
care of your hormones. Because
Exactly. Now that is, and I give them a target. I tell them that I will do this laser for you after 1 month. I want you to have knocked off 4 kgs in this 1 month in the right way, with exercise, with diet, with everything. Get on the right way and come back. And then they ask me, can you prescribe a diet for me? I said, I can, but I won't, because I'm not a nutritionist science-wise. So please
Yeah,
meet
meet
somebody
an
who's
expert,
more
yeah.
scientifically trained than me for the diet. So that's A. Second is also important, again, what we spoke about lasers. What matters is what technology you're using, who is doing the laser, and what is the make. That means you better not pick up a cheaper technology. See to it that you have trained doctors doing your laser. In my clinic, we have only a doctor who handles the laser device.
Yeah.
And see to it that you know whom you're going to. Don't go to who gives you the cheapest laser.
But does it work for every skin type, laser? Or is there a particular
it will
skin
work
type?
for every skin type if you're using the right laser.
Okay.
For example, we have lasers which are meant for darker skins, we have lasers which are meant for thicker hair, and we have lasers which are meant for thinner hair.
Okay.
So finer hair, thicker hair, darker skin, lighter skin, these are parameters to be considered when you're getting your laser done. So it's extremely important that you do that. I had read an ad which said, this is your package for lifelong laser.
Yeah.
I mean, why would you want to do a laser lifelong? You might as well go and just wax lifelong.
No, that's what I wanted to ask you. When you see such packages and when you see such ads, also laser is meant to reduce your hair so that you do not have to wax,
Exactly.
right? After a
Yeah.
point. But does that happen? Do you reach that point
Yes,
where
you do
your
reach
hair
that point.
reduction is so
Absolutely.
efficient and your hair growth
It
is so
does.
minimal that you do not have to wax?
Almost always, barring a few exceptions, if you're using the right laser, you will come to a stage where you're left with such fine hair on your body that you don't need to do anything about it. However, having said this, after finishing the stipulated, say, 8 sessions or 10 sessions or 12 sessions, depending upon the laser and the skin type, we do call them for a maintenance, maybe once every 1 or 2 years.
That's okay.
And that is absolutely the way it should be if you're getting into laser hair
Yeah.
reduction. Do not fall in for fads where you say, come whenever you want and do a laser. What's the point? Because then if you're not damaging your skin by the waxing, you will definitely damage it with the laser.
Yeah, and of course, you're doing it with the purpose.
Yeah.
And the intention that you never have to wax again.
Agreed.
And you have to stay hair free and just relax.
Absolutely.
And get over this hassle of waxing and maintaining your skin.
Right technology, right doctor, right hormones, and you're set for life.
Amazing. That's amazing.
Another thing is, don't wait till your hair grows grey to go and laser, because we yet don't have good lasers for grey hair.
Grey hair.
Because a laser light follows the pigment. The chromophore out there is the pigment.
Okay.
So don't wait for that long. So if you really want to get rid of your hair, don't wait till you start getting greys and then go in for the laser.
That's amazing. Yeah, that's some great
That's
information
a tip I
out
really
there.
want to give to everyone.
No, that's some great information out there. That's amazing. And are there any side effects of this laser that one should be aware of?
See, if it's not done well, if it's done with the wrong system, then yes, there are side effects. But I would like to believe that our podcast out here is to make people do the right thing.
Yeah.
So if you're doing the right laser with the right doctor and with the right consultation, I don't think laser hair reduction has been ever more safer than what it is today. With the technology, like I think I got the laser in my clinic first time in 2005. And from there till date, I mean, it's almost become a breeze. It is now most comfortable, painless, and quicker. But yes, you need to upgrade your technology with every few years, because today we are in an age and stage which is so great. Technology is ever evolving.
Yeah.
So you
and
need
at the
to
speed of light.
Yes, so you need to be with the right technology and you're going to do great.
Amazing.
Yeah.
Coming to hair now.
Yeah.
Very important topic.
Yes.
But I want you to throw light on the hair growth, hair fall issues that people face, and how minoxidil is like the most, again, like how isotretinoin for skin, I've heard minoxidil as the most common line of
Commonly
treatment
used.
for hair. A, is it safe? B, for how long? And C, is it possible to not get onto minoxidil for your hair problems? I can do it naturally.
Now, hair is a cycle.
Yeah.
It's a 9-month cycle. We have 3 phases: the anagen, the catagen, and the telogen phase. With which I mean anagen is a growth phase, catagen is a resting phase, and telogen is a shedding phase. Every single person goes through this cycle. So, with which I mean every single person will go through a shedding phase, which is called the telogen. Sometimes this telogen or the shedding phase is extended because of illnesses, poor diet, nutrition, hormones, a lot of these things. So yes, your question, can we naturally take care of it? If we find out the cause of the telogen, you can correct the deficiency, get on a better diet, sleep well, reduce the stress, and you will get your hair back. Pregnancy, post-pregnancy hair fall is a given. It's called the postpartum hair fall. So in that phase, eating well, sleeping well will really help, and you'll get all the hair back. However, more and more we are seeing people getting into female pattern hair loss, which is probably happening throughout life. Genes play a huge role. People with more stress, people who are leading stressful lives, like working women especially, because they are compromising on only one thing in life, and that is themselves.
Yeah.
A working woman will not compromise on kids, will not compromise on family, will not compromise on work. So the only thing they end up compromising is on themselves. I have seen more and more working people getting into hair thinning, because they don't have that kind of time to look after their hair, and plus you're working, so you're going to end up shampooing your hair daily, because that's the way
look
it is.
good. Shampooing and also hairstyling and heat
everything,
treatments, all of
everything.
that. Yeah.
Now in such cases, minoxidil will help. because you can apply it. And if you're using a topical minoxidil in phases, that is applied for 3 months, withdraw it for 3 months, you will be able to take it on for long. Topical minoxidil doesn't do anything systemic to you. So it's not going to harm you, but it can harm the quality of your hair. It
In
makes
the long
it dry.
run.
Yeah, it makes it dry, it makes it brittle. So in such cases, using it sparingly, rightly, and using a good shampoo, a detergent-free, or what is it called, a sulfate-free shampoo,
SLS
and a
and
conditioner will make a big difference.
paraben, yeah.
Other than that, hair has become a huge problem per se, because people are coloring more, people are blow drying more. Also, people who color more will always have a little bit of frizziness in the hair, and the hair will go dry, right? If you keep coloring, it will go dry. So in such cases, your nutrition, so eating the right product, eating the right kind of
Food,
green vegetables,
yeah.
eating the right kind of nourishment which gives more hydration, because hair also is an internal thing. So all that will help. Not to take away the fact that finally genetically also we are programmed to have a certain kind of hair, and like your skin, your hair ages as well. So as you age, the hair will get thinner, and that's the progression. So hair is an entire science. Here I will say that it largely depends upon your nutrition. And yes, if you are carrying the gene of hair thinning, then we will have to get into other modalities like a PRP, that is platelet rich plasma. We have low light laser therapy, so that can help a bit to stimulate your follicles. Now we have exosomes. Exosomes are better growth factors than PRP, which can help in hair free growth as well.
Okay.
And of course oral nutrition and oral vitamins.
So the PRP and the exosomes, are these treatments absolutely safe and they don't affect your overall health? I'm
They
assuming.
don't. Again, it has to be done in the right way with the right PRP tubes and the right right elements that you're using as your PRP solutions. So that also matters.
Okay.
But if it is done rightly, then yes, it shouldn't have a problem.
Okay.
Yes.
And what about these IV drips that we hear a lot about today? People just get into these clinics that are doing IV drips. They pick up a package, they take it, and they kind of get going. Is that the way IV drips are supposed to be taken? Because what I know of IV drips, they are like active and concentrated nutrients in higher dose, and they get right into your system, right? As a nutritionist and as a health coach, for me, it doesn't sound right if you just go and pick up anything. I mean, what's your take about this?
IV nutrition, let me first begin by saying that I'm a huge fan of. And I do a lot in my office, and I think a large amount of my percentage of my practice is IV nutrition. Second thing, IV nutrition, as the name suggests, is intravenous nutrition and has to be tailor-made. There is no other way. You cannot have ready drips, those pink colored, yellow colored, white
ready
colored,
packages.
Cannot be done. I also cannot understand how there can be any pre-mixed package of nutrients done which can be safe to put in whenever you want to put it. So what we do is we take 100 ml of IV or 100 ml of a normal saline. Now the base also depends upon the person. You can have a normal saline, you can have an RL, ringolactate, you can have a dextrose. Depending upon the individual and their lifestyle, their nutrition, their metabolism, we choose the base. And then we choose what all we put into your IV drip.
Right.
And it goes with that. So it has to be tailor-made. It has to be broken at that minute, entered into your IV jar and then given. It has to be freshly prepared. It cannot be a pre-mixed. So that's your baseline. Please do it from a certified doctor who understands nutrition. Please do it in a medical setup. Please don't take these drips at home, because we have seen reactions of IV drips in our clinic.
Wow.
And we need to have your crash tray ready, which you can take care of reactions when they happen. So it has to be in a medical setup, has to be under guidance, has to be with a doctor in the room, and has to be with a certified nurse there to take your IV vein, if not a doctor. So these are things which are very, very important. You need the sterility, you need the knowledge, you need the acumen, and you need the clinical setup.
Okay.
These are ways which you will get the right IV nutrition. They are great because it helps to have the nutrients absorbed straight into your system rather than taking them orally. So you're not even having gut issues because of that.
Perfect, but you're not supposed to just go and get premixes
No way,
from these clinics that
and not
are
randomly
facilitating it,
not
right?
at all. It has to be done under supervision.
Yeah, because they just name these packages like skin glow package, and then hair
Skin
growth
whitening
package, and then this package and that package, and they're just shoving nutrients into your body.
That's not
but
done.
do you even need it is the question.
Do you need it? Is it going to help you? And how is it going to help you?
And more than that, is it going to harm you?
Yeah, is it going to harm you?
I think that's the most important question.
Thing. So yes, it has to be done well and rightly. But if it is, then it is great.
Awesome. And coming to my last question, which is about these trends. Skin industry is all about trends. Like you rightly said, it's social media, Instagram, everything is all about do this and you'll get this result. So these trends have started cropping up. Now, I don't know the name of these trends, but I've heard these snail mucins and some weird things which sound only very absurd and, obnoxious. What is your take on these trends?
So before I get into trends, let me tell you, medically, as a rule, you cannot have something new happening every single day. Every technology, every science takes a minimum of 5 years to get started. A clinical study takes another 5 years. So you will have one trend coming up only every 5 years. We are talking about a trend coming up every 5 minutes.
Yeah.
So it has to be different names given for getting more followers. And you just want to do something different. Now, how do I say this? When you're talking about...
please say it blatantly, honestly.
So when you're talking about someone's sperm being used for some facial.
Whose sperm?
Some salmon sperm, something, they are used for facials.
Oh my God.
I wonder where they are got from. I don't know where they come from. I don't do them in my clinic. I don't think it is a USP of my clinic. I feel that it cannot be a USP of any... It shouldn't be a USP of any medically driven
expert. Yeah.
So that is one. Whereas some trends can be good. Like, for example, this whole trend of using retinol, I think I give into it. And I feel that it has helped. I mean, if it is used rightly. For every 3 wrong trends, we will have at least point or half a trend which is good. So yes, some are good, but some of them are obnoxious and beyond.
Yeah.
Now, how do you... the ones which are good, should we even call them trend or should we just call them technology?
Yeah.
And we stick to that. So I'm not in great favor of trends, and so I think, yeah, that's about it. So the other day I was just going through Instagram and I saw some very popular doctor, talking about the largest selling procedure in their clinic being a sperm facial or a salmon sperm facial. And I was wondering that hopefully doctors don't succumb to this, because we try to keep the flag and we try to continue to be the torchbearers of science, and I hope we continue to do that and not many people fall into this.
Oh my God.
Yeah.
Thank God for giving us all the clarity and the debunking of these myths and these trends that we are seeing around. It's crazy.
Yes, it is.
We are living in a very stimulated world. Everything is external stimulation.
Yes.
We have so much information overload, and it's crazy. Sometimes you really don't know what to believe and what not to believe, but because you want results, you probably fall prey to these rubbish things that are coming up.
I also feel that skin is such a thing that there is nothing which is enough. That means people just want to do better and better and better. I want to look better, look better, look better. There is no benchmark to say, like with every other illness. For example, you have jaundice. You go to a doctor, jaundice is treated, and you're back home. You will not say, I want my jaundice treated better.
Better liver, more better liver.
Like, there is nothing like that. But skin can go on. I want a better skin, better skin, better skin. So
I want to be more fairer. I want to be more younger.
Yeah. So there's never an end point. Sometimes I will feel... It'll come to a point when a 50-year-old will say, now I want to look 2. So from 50, you'll become 40, you'll become 30 and saying, now I want to become a 2-year-old. So it will just keep going on.
Yeah.
And I think one shouldn't succumb to this. And we need to age gracefully.
Yeah.
And you can age gracefully also only with science. It is also a myth to say that I will age gracefully without help. We all take help in some form.
I think that's
what that help is individual.
Yeah.
Some people may want to look young with makeup and still look young and nice. Some people may want to go a step beyond.
Yeah.
So see where your comfort zone is, but just do it scientifically.
Yeah. I think the biggest sign of strength is seeking help. And there's no shame about it. There's nothing to be shameful of, because when you seek help is when you actually are on the right path without putting yourself through a lot of trauma and torture in every possible way.
Totally agree. So yeah, when you're doing it, and if you think looking a certain way is going to add to your confidence, please go ahead and do it. But in that case, do it the right way.
So true. Coming to my next segment, which is myth and fact, I'm going to give you a statement and you need to tell me whether it's myth or fact. And if it's a myth, then what's the truth? Okay. Oily skin doesn't need moisturizer.
Myth. Oily skin needs hydration as well.
Okay. The higher the SPF, the better the sun protection.
Myth. You need just a broad spectrum sunscreen with blue ray and you're sorted.
Okay. Natural or DIY products are always safer.
Complete myth. I've seen so many reactions with people who have applied besan and multani mitti on their face. And so myth.
Myth. Acne is caused by dirty skin.
Let me say acne is aggravated by dirty skin.
So partly it's a fact.
Okay.
No, I'm asking you.
Acne cannot be caused by dirty skin.
Okay.
Because there are a lot of people, you will see street urchins who are always dirty and they won't have acne. So it can be an aggravating factor if you already have an acne.
Okay.
But it doesn't cause acne.
Okay. If it tingles, it means it's working.
Myth. It is myth. It is a myth, but not everything. But yes, we can also say that if it tingles, it doesn't mean it is not working also.
Okay.
But yeah.
Sunscreen is only needed on sunny days.
That's a myth. I mean, you can make a habit of wearing a sunscreen on cloudy days as well.
Okay. Anti-aging products are for people over 40.
Let's rephrase this and say that let henceforth anti-aging be also called prevention of aging rather than reversal of aging. In that case, you can start the anti-aging post 30.
Okay. You can shrink pores permanently.
Myth. You will always, having skin pores is a kind of skin texture you have. You can better it, you cannot reverse it.
Okay. The more skincare products, the better.
Completely a myth. Yeah. Fact is, less is more.
Less is more. Retinol thins the skin.
Retinol dries the skin.
Okay.
That means your hydration levels go down, and some people believe that when a dry skin equals thin skin, which is not true. So if you're using a retinol, be sure to keep using a moisturizer with it.
Okay. So what do you use retinol for basically then?
Retinol is an anti-ager. Retinol is a skin stimulator. Retinol is a collagen stimulator as well.
Okay, but it dries the skin.
It will dry the skin because it takes away a little bit of the moisture. But that is temporary. So you feel stretchy. So use a moisturizer with it.
Okay.
Then you're in a safe place.
Got it. And now coming to our very last segment, which is a rapid fire.
Okay. So this wasn't rapid fire?
This was myth and fact.
Oh, okay.
Let's make this fun and rapid. Okay. So, morning person or night owl?
Night owl.
Okay. Coffee, tea or green juice?
Coffee.
Really?
Really, all bad habits.
One skincare step you never skip?
Sunscreen.
Okay. If you weren't a dermat, you'd be?
If I wasn't a gynec.
Really?
I always wanted to be a gynecologist, but unfortunately I skipped that bus.
Beach vacation or mountain retreat?
Beach vacation.
What's one skincare thing that's always in your handbag?
You'll find this funny, but a hand cream. I wear a lot of gloves all the time, and that's why I have dry hands, and I keep moisturizing my hands because I'm very uncomfortable about my hands being dry.
Okay, makes sense. Your favorite skincare ingredient of all time?
Sodium hyaluronate.
Is that a counterpart of hyaluronic acid?
Yeah, it's a molecule for hyaluronic acid, and I do believe that if we can maintain the hydration levels in skin, we will do a huge favor to you will do a huge favor to your skin as an anti-ager.
One thing you tell your younger self about skincare?
I wish I'd started using a sunscreen earlier.
Okay. One book or podcast that changed your perspective about anything in life?
This is cliched, but Atlas Shrugged by Ayn Rand changed my perspective of life and everything.
Okay. What's the one superpower you would wish to have?
I wish I could learn to ignore.
Ignore what?
I wish I could learn to ignore everything that bothers me. And so, but my problem is I end up reacting to most things that bother me. Sometimes I wish I could not react.
Maybe meditation can help?
I'm dying to do this, but I'm not getting a hand on it.
Yeah, I'm sure you'll find
Yeah.
your path soon.
Yeah.
Because that is, if that's your
It's-
superpower, you want,
I want
like you
the
want to ignore
superpower.
things.
Yeah,
Meditation
And
is.
I think my husband is full that. I mean, he ignores everything he doesn't like.
Yeah, so
he
meditation
just
helps you to get to
is
that
happy.
stage where you just ignore.
I
It
just
doesn't
want to get
affect
there.
you.
Yeah, I just want to get there.
That's amazing. That was fun.
Thank you.
Thank you so much, Falguni.
Thank you.
I've really had an amazing time with you
Thank you
today
so much.
because there's so many things that I've learned from you, which I also wanted to
Yeah.
understand about skincare, about these actives, about products, treatments,
And
and
I'm also going to take a cue from what you said, and for a change, I'm going to try taking care of acne with just the gut. Let's see.
yeah, I mean, why not? And
Yeah,
I've
why
learned,
not?
and I've learned from you that
Yeah.
isotretinoin may not be all that bad if done in the right way. So
Yeah.
that's amazing. I think this was a great exchange of knowledge and information, and I've had an amazing time. And I'm sure my listeners also have taken back a lot from you.
Thank you so much. Thanks. It was a pleasure.
Thank you so much for staying right till the end of this episode. And I'm sure if you're a skin and hair care lover, then this episode must have given you a lot of insights into the right ways of taking care of your skin and hair. And if you found this episode useful and informative, don't forget to share it with your friends and family and drop in your comments below because we are reading every comment that you drop in and we are going to answer all your queries. Also, subscribe to our channel for getting notified about more such informative podcasts and episodes that we put out once every 10 days. See you in the next episode. Stay tuned.